Joining us now, we have MPP Sam Oosterhoff from Niagara West. Sam, welcome to the program.
Thank you, Mike.
So a big announcement today off the top about some money for tourism affecting Niagara. Can you elaborate on that?
Absolutely. So thankfully, Minister MacLeod and our Ministry of Heritage, Tourism, Culture and Sport has announced $1 million for Niagara to be invested into destination tourism. And that's, of course, as we anticipate reopening, we're going to need marketing dollars to make sure that we encourage people to come back to Niagara, encourage them to support our local industry in a safe fashion. And so that $1 million is spread between the Niagara Tourism Partnership and between the Niagara Falls Tourism Association.
We have to talk a little bit about the announcement this week about moving into phase 2 and, of course, the fact that Niagara was left off of that announcement for phase 2. A lot of people upset about that. Just the other day, we spoke to a business owner, a gentleman that owns a restaurant, one in St. Catharines and one in your riding of Niagara West. And very disappointed, I would imagine he is today, though we spoke to him a couple of days ago, very disappointed that he will not be able to open up his restaurant. In your opinion, why do you think Niagara was left off of that list?
Well, my understanding from some of the conversations I've had over the past couple of days with the Ministry of Health and our medical officers team, the chief medical officers team, my understanding is it's partly because of the numbers. Last week there was quite a significant surge because of the farm community that had an outbreak. And so although our numbers were on a downward trajectory for a number of different public health metrics, including being a border community, our neighboring communities all had increases, Haldimand, Hamilton, and we also had an increase last week. For those reasons, I understand we were not reopened, but I do anticipate that we'll be able to reopen fairly shortly.
Were you consulted at all about Niagara being left off before that decision was made?
Well, this isn't a political decision. It's a health decision made by the Chief Medical Officer of Health and his team. And so they came to that decision based around key public health metrics. And of course, we're not the only ones in this situation, from Durham to Toronto, Halton, Peel, Niagara. Many other regions are in a similar boat around the Golden Horseshoe. And so although I wasn't asked, it was not a political decision. It's a public health decision.
You mentioned the other areas as well, the other regions, and all of them around the Golden Horseshoe, and all of them very populous regions. Would that be a factor as well in your estimation?
I know actually even in in Sarnia as well, and in Windsor, they were also considered to be higher risk areas. And I do believe it comes down to the numbers. And so that's been something that the Minister of Health also spoke about yesterday. And I know that David Williams, our Chief Medical Officer, has said we need to see the numbers coming down in some of these areas. But I also understand the contiguous nature of the Golden Horseshoe and the fact that we are now part of almost the greater GTHA just by virtue of commuting and the amount of visitors that we have coming through our area. So I understand why it is the way it is, but I also understand the frustration from people who have waited a long time before being able to go and get a haircut or being able to open their small business, and I hope to see it raised fairly soon.
Dr. Hirji was quite vocal that he was not, as the public health official here in the Niagara region, he was not consulted about what those numbers actually meant. And I think it's his opinion that if they dug a little bit deeper, they would realize that, if you set aside Pioneer Farms and if you set aside the long-term care homes, Niagara is actually doing quite well with COVID-19.
Well, I do know moving forward that we're going to be making sure that Dr. Hirji is involved in all those conversations. And I know that Dr. Williams and he will be speaking this week about that. I understand there was a conversation over the weekend, whether or not that was a consultation proper. I think, some terminology differences there, but I know moving forward, we want to make sure that he's engaged. I spoke with him yesterday as well, and we're going to be making sure that he is involved in all these conversations.
Another announcement that moves a little bit closer towards opening all of Ontario up, the fact that gatherings can now be up to 10 people, and also that daycares can open up. And I'm sure a lot of parents are very happy as they potentially start being able to get back to work that some of those daycare centers will be open.
Yes, it's going to be very important, an economic prerogative for sure that we have that support in place for parents who are returning to work. But we recognize our first priority is the health and safety of our children and staff in those childcare centers. So no one's being forced to reopen, but yes, in consultation with the chief medical officer and following very strict safety guidelines, we will be seeing childcare across the province reopening this Friday, aligned with many areas of the province moving into stage 2. So it's exciting news, but we have to always still be careful and make sure that we're following protocols to make sure we don't see a secondary surge.
Thanks again for your time, Sam. We appreciate it.
Thank you very much, Mike.